Hey everyone, Animal-Based Dad here. So here in the UK, it's no real secret that we find ourselves in a bit of a sorry state in regards to metabolic health, metabolic dysfunction, and the ongoing struggle with chronic disease, which is becoming more and more prevalent in the general population. It exponentially increasing across the last decade or two at least, probably longer than that. But it's quite interesting to see the rising realization amongst the general public that when you go to your GP, your general practitioner, your primary healthcare physician, for those not in the UK, not familiar with the acronym GP, so when you go see your doctor, your primary healthcare doctor, you're seeing someone who, unless they have taken a specialized interest in nutrition and chosen through ongoing professional development to spend dedicated time learning about nutrition, you're speaking to someone who has spent less than 1% of the entirety of their medical training learning about nutrition. Think about that for a little bit. So, a medical student here in the UK first completes a general medical degree referred to as an MBBS or the equivalent. This study typically lasts 5 to 6 years. During this period, nutritional training is usually taught within the broader context of medical subjects such as physiology, biochemistry, and public health. So there's no dedicated training on nutrition. It's taught within the context of other things, which is fine. But in total, so we're talking 5 to 6 years of training. 5 to 6 years of training. Within that time, the dedicated modules or lectures specifically focused on nutrition or covering nutrition as a subject matter are extremely limited. It is suggested that most UK medical schools provide between 10 to 24 hours of formal nutritional education to their medical students throughout the entirety of their course. So, throughout the entirety of the undergraduate medical education, the MBBS or the equivalent, which is the first general medical degree that a medical student needs to get in their path towards becoming a general practitioner, out of their 5 to 6 years of study, they spend, on average, somewhere between 10 to 24 hours. 5 to 6 years of study, 10 to 24 hours of that 5 to 6 years is all they get covering nutrition. That's it. That's the absolute totality of the education that they're getting. Once they've completed that, they go on to what's called foundation training, which is F1 and F2. So after completing their medical degree, newly qualified doctors undergo a 2-year foundation program. Whilst this stage focuses on clinical practice, nutrition-related learning may arise in the context of managing patients with specific conditions like diabetes, obesity, or malnutrition, but there is no structured syllabus for nutrition as part of their foundation training. So they've now qualified, they've spent less than 1% of the time in their 5 to 6 years to qualify as a doctor. Now they go on to do their clinical experience training, and there's no structured syllabus for nutrition in that. They may come across it, and it may be necessary for them to look up and learn about nutrition in the context of certain patients' conditions, diabetes, obesity, malnutrition, so on and so forth, but there's no structured learning available to the newly qualified doctor in this 2-year foundation program. Then we go on to GP specialty training. So to become a general practitioner, doctors must undergo an additional 3-year training program in general practice, which includes rotations in different specialties, nutrition education. During this period tends to be patient-centered and condition-specific, focusing on managing chronic diseases like type 2 diabetes, cardiovascular diseases, and obesity. Some training may also cover public health nutrition topics, but again, formal teaching on nutrition is not a central component of GP training. So in the 3 years of general practice training to become a GP, a general practitioner, some training may be encountered related to specific diseases and patients again, but there is no formal teaching on nutrition. It's not a central component of GP training. So in summary, medical students in the UK are estimated to receive less than 1% of their total teaching time on nutrition, averaging between 10 to 24 hours across the entirety of their medical degree. And the lack of emphasis on nutrition training in GP specialty training means that overall time spent learning about nutrition remains very small, even as they progress into their professional careers. Now that should be ringing some alarm bells for you, yeah? Now, if we move on and we compare this to pharmacology training, now remember, we're talking about general practitioners, we're not talking about pharmacists, right? So, the mechanisms of drug action, pharmacokinetics, I think that's pronounced right, basically how drugs are absorbed, distributed, metabolized, and excreted. Pharmacodynamics, meaning how drugs exert their effects, drug interactions and side effects, are taught. Clinical pharmacology, focusing on applying pharmacological knowledge in patient care, including safety, prescribing practices, managing drug-related adverse effects, and understanding drug regulations, is taught. So this is in your basic medical degree. So the time spent learning about pharmacology for a doctor in their first medical training, so remember 5 to 6 years of training, they spend between 5 to 10% of their time. So 5 to 10% of the total curriculum learning about pharmacology specifically. So to try and put that into hours, so in preclinical years, so in the first years of their studies, they spend between 100 to 150 hours. Now remember, nutrition was 10 to 24 hours in totality, right? But you've got 100 to 150 hours on pharmacology alone. Then there's not much on pharmacology during foundation training. So this is the 2-year rotation that they do straight after qualifying as a doctor. But during the 3-year GP specialty training, pharmacology remains a major focus because GPs are responsible for prescribing and managing a wide range of conditions. They receive continued education on safe prescription practices, drug monitoring, and managing polypharmacy. Not sure what polypharmacy is, but yeah. Especially given the rising prevalence of chronic disease that require long-term medication. That sums it up quite beautifully, I think. That sums it up quite nicely for me. So your GP is essentially a legal legitimized drug dealer. And that said, with all due respect to general practitioners, I completely respect what they do, but in terms of chronic disease, you've got to understand that their training, what they're taught to do and how they're taught to do it, has everything to do with managing the disease via pharmacology, and practically nothing, less than 1% of the entire training in the 5 to 6 years plus 2 years plus 3 years, that's 10 to 11 years of training. Less than 1% of the formal structured syllabus through that entire 10 to 11 years is spent on nutrition. right? 5 to 10% of the time, if not more. No, in fact, it is more, because you've got 5 to 10% of the initial training, and then you've got an additional 30% of time through the specialty training. So the GP specialty training is spent on pharmacology. So that's 35 to 40%, nearly half of the time spent becoming a GP, right? About 40% of time, to try and give it an approximate number. 40% of time is spent learning about pharmacology, about the prescribing of and management of drugs and how they work and what they do and what to do. Like, you're dealing drugs, folks. You're basically learning how to manage conditions, right? And it summed it up nicely here. So they receive continued education on safe prescribing practices, drug monitoring, and managing polypharmacy, especially given the rising prevalence of chronic diseases that require long-term medication. That is the mindset of the average general practitioner. Thank goodness we have some that have had their eyes opened and they understand that nutrition and lifestyle plays such a fundamental factor that it has to be the very first thing that you go after, and you have to go after it from an angle of not paying attention to dietary guidelines, because the dietary guidelines are garbage, absolute garbage, failed experiment. But you have to go animal-based, low-carb, whole foods. That's your holy trinity so far as nutrition goes. Animal-based, low-carb, whole foods. That's what you want, and that's what reverses chronic disease. And we see it all the time now. We see people reversing their type 2 diabetes, people putting chronic conditions into full remission, including cancers. It's absolutely amazing to see what nutrition is doing, but your general practitioner is not, unless they take a specific interest and choose out of their own to do continued professional development outside of their qualifying. Your GP, unless they've chosen to do that, do not get any training on nutrition that is worth speaking of. Less than 1% of the 10 to 11 years taken for them to qualify and be a fully fledged general practitioner here in the UK, less than 1% of that time is spent learning about nutrition. So tell me how effective this person is going to be in trying to help you as a patient, you as a person who's trying to make positive changes in regard to nutrition and lifestyle. How effective are they going to be in giving you information that you need? They've spent less than 1% in the decade they've spent getting qualified learning about it. Well, they're not going to be much good. And that's with all due respect. They're not going to be much good at all. And that is why we see the continued rise of the so-called citizen scientist, health influencers, people who take a keen interest and spend time in this. I've spent over 6 years now learning about nutrition because I intervened in my own health. I took the steps to intervene in my own health, learn what I could about it, and developed an absolute fascination for it. And I'm 6.5 years at least down the rabbit hole at this point. I'm just finishing off the manuscript for my first book. Like, you've got to understand that when you're talking to your GP, unless you've got like a David Unwin, a Dr. David Unwin, absolute legend, someone who took that interest, went and spent the time in and on his own, and chose to learn about nutrition and how nutrition and lifestyle change helps the patient, and has done absolute phenomenal work. Absolute phenomenal work. And I strongly encourage anyone who's curious about Dr. Unwin's work to go look it up. Dr. David Unwin here in the UK, absolute legend, pioneer in the field. But your average Joe general practitioner, your average Joe NHS general practitioner, less than 1% of the decades spent for them to get to that point of calling themselves a general practitioner, less than 1% of that time is spent learning about nutrition. Right? That's scary. That's scary, and that needs to change.